Your body is always speaking to you. Sometimes it whispers, other times it shouts. The trick is knowing when to listen and when to act fast. This video is not meant to scare you. It's meant to protect you. Many older adults ignore or downplay symptoms. They say, "It's probably nothing," or "I'll wait and see." But in some cases, waiting can be the biggest mistake. Today we'll talk about 7 physical warning signs that doctors say should never be ignored, because they could mean something very serious is happening inside your body. Please stay with me to the end. One of these signs might save your life, or the life of someone you love. Sign 1. Slurred speech or drooping on one side of the face. Have you ever tried to speak but the words came out wrong? Or looked in the mirror and noticed one side of your smile wasn't quite right? These are early signs of a stroke, a medical emergency. If your words are slurred, if you can't lift one arm, or if your smile looks crooked, you must get help right away. Remember the word: fast, F, face drooping, A, arm weakness, S, speech difficulty, T, time to call emergency services. Every minute matters. The sooner treatment starts, the better your chances of recovery. Story. Robert, a 68-year-old veteran, dropped his coffee cup one morning. His words sounded strange. His wife noticed his smile was uneven. She called 911, and doctors said that fast action saved his brain and his life. Sign 2. Sudden chest pain or pressure. If you feel sudden pressure, tightness, or a strange squeezing in your chest, it might not be indigestion. It might be your heart warning you of a heart attack. Chest pain that spreads to your neck, jaw, shoulder, or arm should never be ignored. Neither should a heavy feeling in your chest that comes out of nowhere. Sometimes the pain is mild. Sometimes it's just a strange discomfort. But if it feels new, lasts more than a few minutes, or comes with dizziness, nausea, or trouble breathing, go to the hospital immediately. Story. Helen, a 74-year-old teacher, felt tightness in her chest while reading. She thought it was gas, but her daughter insisted they go to the hospital. Helen had a heart attack. Quick action saved her life. Sign 3. Difficulty breathing while resting. Feeling out of breath after climbing stairs is normal. But if you're sitting still, watching TV or lying in bed, and you feel like you can't catch your breath, that's a red flag. This could be a sign of heart failure, a lung infection, or even a blood clot in your lungs. Story. Walter, a 76-year-old retired electrician, was watching TV when he felt like he couldn't breathe. There was no chest pain, no fever, just a scary feeling of not getting enough air. Doctors found a blood clot in his lung. He said, "If I had waited, I might not have woken up." Shortness of breath without exertion is not normal. Don't wait. Get checked. Sign 4. Sudden confusion or disorientation. It's easy to dismiss confusion as part of getting older. But if it happens suddenly, or if someone you know seems lost or starts saying things that don't make sense, it could be very serious. Sudden confusion can be caused by a stroke, a brain infection, low oxygen, or a reaction to medication. Story. Linda, an 80-year-old woman who lived alone, was found in the hallway by her neighbor. She didn't know how she got there. At the hospital, doctors found she had a urinary tract infection, which had caused delirium. With treatment, she returned to her usual self. In older adults, the brain often shows distress first, even before other symptoms appear. Don't ignore confusion. It may be the first sign that something deeper is wrong. Sign 5. Severe or unusual abdominal pain. Aches and pains are common, but if the pain is sudden, sharp, or getting worse, especially in the belly, don't ignore it. It might be a ruptured organ, twisted intestine, internal bleeding, or pancreatitis, all of which can be deadly if left untreated. Story: Frank, 72, felt a stabbing pain in his stomach after dinner. He thought it was gas and tried to sleep it off. The next day, he was too weak to stand. A twisted intestine had cut off blood flow. Emergency surgery saved him. If your abdominal pain feels different than usual, don't try to be tough. Go to the hospital. Sign 6. Vomiting that doesn't stop or vomiting blood. Everyone has an upset stomach sometimes, but if you're vomiting for hours or if you see blood, you must seek help immediately. Vomiting blood may look bright red or dark like coffee grounds. Either way, it can mean internal bleeding, ulcers, or a torn esophagus. Story: Evelyn, 79, was taking over-the-counter pain pills for arthritis. One night she threw up and saw dark specks in the sink. Her grandson called an ambulance. At the hospital, doctors found a bleeding ulcer that had gone unnoticed for months. Vomiting blood is never normal. It means something inside your body is broken, and it needs urgent care. Sign 7. High fever with a stiff neck and light sensitivity. A fever usually means your body is fighting something off. But if it comes with a stiff neck, confusion, severe headache, or sensitivity to light, it could be meningitis, a dangerous infection of the brain and spinal cord. This infection moves fast and can be deadly if not treated immediately. If you or a loved one can't bend the neck, feels weak or confused, and has a fever, call emergency services right away. Doctors say, when we see this combination of symptoms, we drop everything. That's how urgent it is. It, too. Sign 8. Sudden weakness or numbness in the legs or arms. Have you ever stood up and felt like one leg just gave out on you? Or maybe you noticed tingling or numbness in one arm. Sudden weakness or numbness in your limbs is not something to ignore. It could be another sign of a stroke, or it could mean nerve damage, a spinal cord issue, or even a blocked blood vessel. The key word here is sudden. If this happens out of nowhere, while you're sitting, walking, or doing something simple, it's time to act. Story: Charles, 73, was brushing his teeth when his left leg suddenly felt weak and gave out. He fell but didn't think it was serious. A few hours later, he couldn't lift his arm either. At the hospital, doctors confirmed he'd had a minor stroke. If he had come in right away, they said, his recovery might have been easier. Don't wait until the weakness spreads. If one side of your body feels strange, heavy, or different, get checked immediately. Sign 9. Vision changes or sudden loss of sight. If your eyesight suddenly gets blurry, or you see double dark spots or even lose vision in one eye, it could be a sign of a serious medical issue. Some vision changes are caused by age-related eye problems like cataracts or dry eyes. But if it happens suddenly, it might mean a stroke, a retinal detachment, high blood pressure damaging the eyes, or diabetes-related vision loss. Story: Mary, 76, was watering her plants when everything on the right side of her vision went dark. She thought maybe it was just the light, but it didn't go away. Her daughter rushed her to the emergency room, and doctors said it was a warning sign of a stroke in the eye. With fast care, her vision came back. Sudden changes in sight are never normal. Don't assume it's just your glasses or dry eyes. Your eyes are connected to your brain, and they can show early signs of trouble. Sign 10. Unusual bleeding from any part of the body. Bleeding is something we usually see outside the body. But if you notice bleeding in places you shouldn't, like in your urine, your stool, when you cough, or from the gums or nose, it could be a warning. This could be a sign of colon cancer, internal injury, bleeding ulcers, medication side effects, especially from blood thinners. Story: Gerald, 78, saw blood in the toilet after going to the bathroom. He thought it was hemorrhoids and waited a few weeks. When he finally went to the doctor, they found colon cancer. Thankfully, it was still treatable, but the delay made his treatment harder. The rule is simple. If you bleed and you don't know why, go get checked. Blood in places it doesn't belong is your body's way of waving a red flag. Sign 11. Sudden dizziness or fainting. We all feel a little lightheaded sometimes, especially if we stand up too fast. But if you feel dizzy out of the blue, faint, or feel like the room is spinning, it could mean low blood pressure, heart rhythm problems, dehydration, or even a mini stroke. Fainting, especially for older adults, can be very dangerous, not just because of the cause, but because of the risk of falling and injury. Story: Alice, 82. Fainted while getting up from the couch. She thought she just stood up too fast, but her daughter insisted on checking her blood pressure. It was dangerously low. At the hospital, doctors found she was dehydrated and had an irregular heartbeat. Dizziness that comes on suddenly, especially if you haven't been active, is a reason to get checked. Would you like me to continue and add a few bonus signs? Or would you like a full script file to download and edit for video narration? Closing message. Now you know the 7 warning signs your body might send when something serious is happening. Slurred speech or drooping face, chest pain or pressure, shortness of breath at rest, sudden confusion, severe belly pain, vomiting blood or non-stop vomiting, high fever with stiff neck and light sensitivity. If you notice any of these, don't wait. Don't second-guess yourself. Go get help. You know your body better than anyone. When it speaks, listen. And remember, it's better to go and find out it was nothing than to stay home and find out it was everything.